Hello everyone, this is Chadi Alraies from SIF 2024 and we are celebrating the 20th anniversary of SIF, and with me, the every year guest is Coylewright. She's an interventional cardiologist and structural interventionist, and she always brings new topics to the discussion. Megan, thanks for being with us.
Thanks for having me.
So we spoke about a lot of technology about how to treat severe AS. High risk, extreme risk, intermediate, and low risk. Now we are looking at a different cohort of patients who are the moderate AS. So tell us about what's going on in that space.
There's a lot of literature to support that cardiac damage happens before the valve becomes severely stenotic. Perhaps we're intervening too late. And in our practice, we see that. We have a patient come to us with severe aortic stenosis. We're prompted to fix the valve because they're symptomatic. They get the valve and they still have heart failure symptoms. So the question is, should we be intervening earlier in the disease process?
And as you said, severe AS is not just only the LVH, also the fibrosis that happen in the muscle because of all this force against the tight valve. So, moderate AS. This is very important, and I heard that concept a few years ago, and now you're recruiting for that trial. So what is the idea behind it?
There are two trials, one with balloon expandable valves and one with self-expanding valves, and both are looking at the impact of treating the valve earlier in the process, when the valve is in the moderate stage. Patients that are included in these trials do have to demonstrate that there's some evidence of cardiac damage. So it's not someone who has moderate AS and a completely normal ventricle, although I'm not sure how often that happens. But we're looking at patients who have evidence of heart failure. It can be diastolic or systolic. We're looking at it with echo parameters and lab tests like biomarkers, and then randomizing to either what we call watchful waiting or TAVR. And the patients who are included have to be considered appropriate for TAVR, that is, they're transfemoral candidates without high risk of something like coronary occlusion or other risks like that.
And this, when you say moderate AS, that includes any risk STS score?
Correct.
Any risk, from low to high?
Yes. This is independent of surgical risk.
And how do you said symptoms and biomarkers and echo parameters. So
they actually, depending upon the trial, they don't necessarily have to have symptoms related to the valve. And it is hard to tease out. Many people who are thinking about the moderate AS trials say, well, I have patients who have moderate AS, but they also have diastolic dysfunction from their hypertension or diabetes, or they have lung disease. So they are dyspneic, but I don't know if it's due to the valve.
Yes.
People say, I was always taught in my training it wasn't due to the valve. Well, we don't really know that.
In terms of moderate, same echo parameters like mean gradient 30 to 40, velocity?
The gradient is 20 to 40, and a valve area of 1 to 1.5 is the general cohort that we're looking at.
And when do you expect this result of the trial?
Good question. It will be years from now still. We're still enrolling in the trials, but perhaps we'll have some clues maybe in the next couple years with some early data. There's a lot of focus in our community, of course, on longer term outcomes with any kind of valve treatment. But I think we'll get some important information about the impact on the heart of treating the valve earlier.
So once the patient screens into the trial, then you'll go through the same workup for TAVR, like STS.
They have to go through the workup before.
Before that.
So they have to have a CTA and either a coronary angiogram or a really up-to-date CT evaluation of their coronary arteries. And they also have to go through an echo evaluation, which is reviewed in a core lab. And then at that point, if they are candidates for transfemoral TAVR, and they meet those criteria of having evidence of cardiac damage, then they're randomized at that time. Patients are really interested in thinking about treating valve disease earlier. From a patient perspective, what I hear from those in the clinic is, so you're telling me this is definitely going to get worse, and when it gets worse, it's going to be life-threatening, but you want to just watch it right now? It doesn't make sense to them.
Well, it's good answer, good question. The answer yet there's too many layers, as you said. Approval, FDA, and all that.
That's right.
Well, that's very interesting. I mean, again, thank you for being one of the sites for this important trial and also bringing new hope and therapy for these patients with the intermediate and moderate AS. Thank you so much, Megan, for your time. Watch these videos and others on SIF YouTube channel. This is Chadi Alraies from SIF 2024. Thank you.
Yeah.